So I'm Andy Kanter. Hi again, everybody. Good morning. I want to tell you about a great opportunity that we at the CIEL and OCL community parts of OpenMRS have offering to the OpenMRS community. And what we'd like to do is do this concept prevalence study, and we'd like to have your participation. So this is kind of the initial announcement for it, but there'll be much more information going forward. And what we're going to ask you for is essentially the need, why we're doing this is because we feel it's important to understand how concepts are actually being used in the OpenMRS databases. And we want to be able to compare information about those different concept use so that we can inform the maintenance management of the concepts more globally. But it's not just about that. It's also about providing information to those of you who manage your OpenMRS implementations about how the quality of your data and how the way you are capturing data within your system compares to people throughout the community. And I had done some work previously with the Odyssey community, and if you haven't had a chance to look at the Odyssey banner over here, please do. It talks about the OMOP data model, which is now a global good by Digital Square. And they had recently done a similar kind of concept survey throughout their community, and it was really enlightening because it really showed just how differently people were using their systems, and which limited interoperability and collaboration. So in the way we plan on doing this, we've created some documentation to help you with the approval process to go actually get the opportunity to take this information out of the database. It's important to understand that this information we would provide a standardized query for you to actually run against your OBS and orders tables. It's very important to understand that this is not identified patient information. There is no PHI or PII here. It's purely summary statistics. And that this will help us have some information about your system, like how you use OpenMRS, but nothing that could tie it to a particular site or certainly to any kind of patients. We've put together a Google form for uploading some questions about this, some metadata about the study, as well as the files that are going to be created by this script that we're going to provide for you. And the idea here is that we're going to analyze this for all of the community that's participating, but also be able to provide each one of you a report back based upon how your data compares based on the concepts, not the actual individual rows, but how the concepts that you're using in your system, not in the dictionary, but how they're actually being used, compares to how other people are being used. So this is just go back one. Yes, thank you. So these are the sample statistics that we're collecting, just so you can see. It's not anything to worry about. We're going to look at the number of patients that are in the database by gender and age group at the time of the year. And then we're going to collect essentially the number of concepts by their concept ID per year. So we can see how concepts use changes over the years and what they are. And this is the list of some information about the concepts from the dictionary that we'll be using, but we're only going to use this information for the concepts that are actually used in your dictionary, in your ops table and orders table, not necessarily what you just happen to have in your dictionary. And this is going to really help CL and OCL understand what's being used, so we're serving the right kinds of concepts, and help you by understanding how you compare to the rest of the community. And the next slide. And so this is just so you want you to know how to get involved. Please contact me, akanter@openmrs.org. You can use that QR code, and we'll make this available certainly to other people. And that goes to a folder, which actually has a bunch of information like a sample IRB proposal. So if you absolutely need to go to an IRB for this, you can use a sample proposal, but use it as an example to actually get requests for approval from your higher-ups, as well as a sample of the Google form that you will be allowed to go to, and lastly, this actual presentation as well, so you'll have that for your information. So thank you very much.